Hey guys, Dr. Michael Maxwell here. So I've seen a few cases in the last few weeks where people have been experiencing Achilles tendon pain and pain that's coming down to the outside of the heel. Now, prior to seeing me, both of these patients were being treated for an Achilles tendon problem, and in two cases, they actually had an Achilles tendon repair after having a complete tear. So post-surgical complications sometimes can be that scar tissue develops along the Achilles tendon, obviously, but that scar tissue can a little bit envelop and entrap the sural nerve. And the sural nerve comes down the back of the leg, comes slightly lateral just to the outside of the Achilles tendon, and pops out through a little myofascial tunnel. And then it basically travels through the loose connective tissue adjacent to the Achilles tendon. And then it divides into the lateral calcaneal nerve and then continues on into the sural nerve, which feeds the lateral aspect of the foot. Okay, so the sural nerve provides sensory innervation to the Achilles tendon. And sensory innervation to the bottom outside of your heel and the outside of your foot. So in one case, a patient experienced only Achilles tendon pain. So a little bit of swelling, a little bit of tenderness on the Achilles tendon, something that would be normally attributed to Achilles tendinopathy, and this is a runner, so not an uncommon injury in this patient population. But had been doing kind of the traditional heel raise, heel drop type activities, wasn't getting any better. In fact, was a little bit worse. So upon more thorough evaluation, what we determined was that there was abnormal tension dynamics of the sural nerve, and that reproduced the pain in the Achilles and a little bit down under the heel. Now, after doing that test, the patient also admitted, despite me asking before if they felt any other pains, that on occasion she did feel pain coming in to the bottom outside of the heel. And then palpation of the nerve in this area also was abnormally sensitive and reproduced that heel pain. The other two patients, slightly different presentations, one of them actually in the process of engaging rehab as she was progressing through her strengthening exercise to, restore and rehabilitate that torn Achilles tendon, started to get a sharp shooting pain into the Achilles, down the lateral aspect of the heel and down the outside of the foot. Now, what she hadn't reported initially and what wasn't all that bothersome for her was immediately post-operatively, she actually had a little bit of numbness in this area on the bottom outside of the heel. And I remember that distribution, that nerve innervation comes from the sural nerve and then becomes the lateral calcaneal nerve and feeds this area here. So what probably happened in this scenario is that as a result of the surgical procedure, probably the nerve was nicked a little bit, or because it was a newer technique where they pull the Achilles tendon down, maybe the nerve was a little bit overstretched and a little bit of damage resulted in that numbness. They didn't have pain initially, but as they started to move more through the ankle and the Achilles, because the sural nerve was essentially adhered, stuck onto the scar tissue around that Achilles tendon, anytime you move the Achilles tendon, the nerve gets unnecessarily loaded or excessively loaded. And that was producing this shooting pain down the outside of the leg. So, point I'm trying to bring forward is that pain in the area of the Achilles tendon, even down towards the insertion of the Achilles tendon or a lateral aspect of the heel, isn't always an Achilles tendon problem, isn't always a plantar fascia problem, it isn't always a peroneal tendon problem. Sometimes it's a result of the sural nerve. So hopefully that helps. And if you are experiencing this kind of pain, it is super important to get the right diagnosis because it happens fairly regularly that we see patients with persistent symptoms of Achilles tendinopathy or plantar fasciitis, who in fact have a neural involvement that is causing their symptoms.